What's up, Warriors? Welcome back to another episode of the Suburban Warrior podcast. I'm your host, Chrissy Pfeiffer, and let me just say happy December. Happy last month of 2025 as we wind down here on season 6. For all of December, we will be running the best of season 6 episodes. So if you missed it once, well, guess what? You get to listen to all the best episodes of season 6 right here in the month of December. And we'll be back next January, yes, in 2026, with a whole new season of Suburban Warrior, season 7, starting first thing in January. So thank you so much for being here. Thank you for being such a supportive listener of the Suburban Warrior podcast. We've had such an amazing year, and I'm so grateful. Record number of listening to the podcast, and that just means that we are helping to empower and educate more and more women each and every week. So on that note, be sure to visit suburbanwarriorpodcast.com to download your free From Pause to Power roadmap. This is everything you need to know for your perimenopause and menopause journey. That is a free download for you. It's everything I wish I knew 10 years ago when I started this journey, right there for you for free. And while you're there at suburbanwarriorpodcast.com, don't forget to sign up for our free weekly newsletter. Basically, this is the top points of each week's podcast delivered right into your inbox. So once again, thank you so much for being a part of the Suburban Warrior podcast. Thank you for being here on this journey. And we'll be back next year with another amazing season of Suburban Warrior, here to empower, educate, and attack midlife wellness with grit and grace.
They are just very variable. You know, somebody in their 30s could do really great, but then a woman in her 60s might not see that same response. So it's just going in, knowing it's going to be a bit of a gamble, but is it worth it for you? It might be worth it for some of your listeners to say, hey, look, there's no downtime. I'll try that.
Welcome to the Suburban Warrior podcast, the podcast that inspires, educates, and empowers women navigating the chaos of midlife, perimenopause, and menopause. I am your host, Chrissy Pfeiffer, a holistic health coach and fierce advocate for women's wellness. With a background in nursing, the pharmaceutical industry, and integrative nutrition, I blend medical expertise with a holistic approach to help women heal naturally, integrate science-backed therapies, and take control of their health. After enduring my own 10-year battle with perimenopause symptoms, I've made it my mission to ensure that no woman has to suffer in silence. Join me as I share expert insights, real-life stories, and actionable strategies to help women reclaim their vitality, prioritize their well-being, and redefine midlife wellness with grit and grace. What's up, Warriors? Welcome back to another episode of the Suburban Warrior podcast. I am your host, Chrissy Pfeiffer, and back this week with a beautiful Suburban Warrior here to share her story and expertise with us. Today is going to be fun and really super insightful because we're talking about lasers. And yes, laser treatment for skin rejuvenation. And I don't know about you, but this is a topic that I'm always really confused by. I'm overwhelmed by it anytime people start talking about it and all the different types of lasers. I feel like the types of lasers change so often. So I don't really know what ends up or what would be best for me. So I'm really excited to get into this episode and talk in more detail about that. Another reason I really wanted to have today's guest on is because so much of what, we talk about and we feel as women in midlife is our mindset. And I think that, I speak for many of us when I say that we don't really want to look like we're 25 again, but we want to just be able to look in the mirror and feel good today about what we see and, the mindset behind what we see, like really loving what that reflection in the mirror. And sometimes that takes work, and that's different for all of us, but being able to really look in the mirror and say positive things to ourselves, like, damn girl, you're really looking good today. Or simply just be able to say, I love you. I love what I see. Be grateful for it. That sometimes takes a little bit of work. It might take great skincare. It might take a little bit more self-care than what we're used to in the past. And it might mean doing some treatments that help us to get there. So I am really, really excited to help impact not only our face, but our mindset today. My guest today is Tara Avidar. Tara is a highly experienced medical esthetician and laser specialist with over 18 years of expertise in advanced aesthetic treatments. She spent the majority of her career working alongside top plastic surgeons and industry leaders, specializing in laser resurfacing, skin rejuvenation, and evidence-based aesthetic treatments. Beyond patient care, Tara is a respected educator and trainer, having mentored and trained numerous physician's assistants, registered nurses, and medical professionals in laser technologies and advanced skincare protocols. Her hands-on approach and deep technical knowledge have helped shape the skills of many practitioners in the field. Committed to science over hype, she continuously refines her expertise by attending leading industry conferences, including ASLMS and Skyton's SEO. Is that right, you, Tara?
Sciton.
Sciton.
Yes.
Yes, Sciton's SEO events, staying at the forefront of cutting-edge treatments. Her mission is to educate and empower both patients and practitioners with honest, results-driven insights, helping people navigate the ever-evolving world of aesthetics with clarity, confidence, and real results. Today, she joins us to discuss what really works in medical aesthetics, common treatment myths, and how to achieve lasting skin health. Welcome to the podcast, Tara.
Oh, thank you, Chrissy. This is so exciting. I can't wait to dive into all this stuff. It's my favorite topic.
Well, I cannot wait to dive into all this stuff because it's a very intriguing topic for me, because someone who doesn't live in this world, anytime I go to the dermatologist, anytime I've been to my esthetician, I feel like I'm asking the questions a lot, but not really getting the straight answers about like what laser is best for me. So we're here today to talk, break it down. You're going to give us all the scoop, and I'm so excited, and I can't wait because I do think I might need a little help in that area. So let's first, why don't you tell us a little bit about your background and how you got into being an esthetician?
Oh, sure. I'm 18 years deep now, and I started my career pretty young. And for me, it started with having a problem that nobody could solve. And that problem was cystic acne. And I was diagnosed when I was 17 years old. And so, pretty young back then. I'm dating myself here a bit. I think this was back in the 90s. And they didn't really have a whole lot of solutions for cystic acne. So it was a long journey. But, with all the dermatology appointments and all the skincare appointments, I just for 5 years struggled like this. And I became kind of determined to find answers and also truth between the marketing, right? Because L'Oreal, Johnson and Johnson, all the products, I would buy everything, and I just wanted an answer. So that kind of drove my passion and kind of brought me to where I am today.
That's awesome. Yeah, I guess back in the day, there were limited options, for there's still really not a ton of options today for people with cystic acne, and certainly not a lot of great options.
Yeah.
But I love that you use sort of your own experience to fuel your passion, to understand like, what can I do? And understand that like your face is everything, right?
Mm-hmm.
When you have to walk around with whatever it is that you might be dealing with, but cystic acne is certainly something that, can really alter how you feel about yourself, how you show up in the world, and really affect your mindset, like I was talking about earlier. So I love that you used that to drive you into this amazing career.
Oh yeah, it was quite an adventure. I actually have a story too, because I remember being in high school, and at that age, it's really impactful on your social well-being too, because
Sure.
I felt like a pretty girl, but I also felt like I looked like a monster at that point. So I just remember always bringing my full makeup kit to high school with me every day.
Yes, yes.
And for those of us that know, when you use a ton of foundation and try to cover things up, a few hours later, your skin heats it up and all of a sudden you look worse.
Yeah.
And so every 2 hours, I'm not kidding, I would go to the bathroom. I'd spend 25 minutes washing my entire face and
Oh my
putting,
gosh.
do you remember Dermablend? That little pot?
Yes.
Oh my God.
Dermablend was like literally like, it's like a shield, right?
It is. Oh, it can cover tattoos.
Yes,
It can cover
yes.
anything. So it came even with like a little pot, a little shovel, and I would just spackle my face like every day.
Oh my
But
gosh.
it definitely was it was hard, but I think just trying so many different things also led me to believe like how much marketing really influences so many things, right? We want to believe that the answer is in a jar.
Yeah.
And I just, yeah, I've found out that it's not so much that.
Yes, exactly. So tell us sort of like, okay, so what have you, what is one of the big learnings that you've had? Sort of like, because I think as women, especially women in general, but really women in midlife in this like anti-aging
Hmm.
phase of our life, we are marketed to so much about
Hmm.
skincare, what we should be using, treatments, all of those things. So what do you think your biggest learning was though, understanding really sifting through the marketing, sifting through all the BS? Like what was it that you found?
Oh yeah. Yeah. It really took years. I mean, just to kind of fast forward, right out of college, I went to aesthetic school and I did all my education in Kansas City, Missouri. And every state is different on how they regulate, the state boards for estheticians. Out there, they required 1,000 hours. Out here, just for reference, they require 300 hours. So it's definitely different from state to state.
Wow.
And I don't know if your listeners know, you might actually know this because of your background, but there is no formal education in lasers or laser physics or energy based devices in medical school, PA school, nursing programs, nothing. So
Yeah.
you really have to get all this training on your own to be
Yeah.
proficient. So I ended up getting my first, it was like an apprenticeship in Kansas City for a dermatologist. And he had two laser hair removal devices. And this is back in like 2007. And it was an ND egg and an Alexandrite. And I worked for free for 6 months to learn lasers. And then after that, I was lucky enough to work for a naturopathic doctor in Kansas City for a few years. And she had like a skin department that she would delegate to me to do. And so moving here now to Philadelphia, I worked for a reproductive endocrinologist that had a laser kind of department for PCOS and
Okay.
other patients, really learning the well rounded systemic reasons why we have skin issues.
Yeah.
And I think just years of doing this and working for some fabulous physicians has really kind of given me that well rounded outlook on why things happen and how to treat it effectively.
Yeah. And was there something about lasers that attracted you to
Yeah,
because I mean, it sounds like you've worked with lasers with so many different parts of the body,
yeah.
and which is fascinating in itself. So was there something about the lasers and
Yeah, it was really just going back to my problem with cystic acne. Once it cleared up, I was left with these indents in my skin. And so going through that
wow.
aesthetic school, I was like, oh, the spa is great and everything, but a facial for cystic acne and scarring is like putting a band-aid on a broken leg. It's really not going to do anything. So I knew like I was going to take my career towards the medical side and I knew I'd be working in private practice more so. And that's where they had those lasers and those energy-based devices. So
Okay.
that's kind of what started it. And I really saw how effective they were. And it just sparked such a curiosity and a passion on just diving into the rabbit hole and finding out more.
Yeah, absolutely. That makes a ton of sense. And I love that because I do think, there's such a wide variety of treatments out there for skin, from your very basic facial to a facelift and
Yeah.
everything in between. And lasers are a big part of it. And so let's start talking a little bit about lasers.
Oh, sure.
Okay, so first of all, how many different lasers are there? Especially, well, let's just talk about lasers for skin
Yeah. Yeah.
rejuvenation, facial. How many different lasers are there?
Yeah. So I think in the umbrella term energy-based devices, let's just start
Okay.
with that, right?
Okay.
So there's ultrasound, there's radio frequency, there's lasers, there's cryolipolysis, which is cool sculpting, and then there's high fem, which is high intensity focused muscle stimulation, and red light therapy, and micro coring and micro needling. These are all non-surgical devices that are used for skin regeneration, and they all work.
Yeah.
And some of them don't work as good as others. And we're going to get into that, but there's a lot of different energies used right now to basically stimulate a wound response, which then elicits this cascade of new collagen and elastin fibers in the skin.
Okay.
So, it's very confusing. I completely understand why people are so baffled. And there's always a new device like every 3 months. And that's why these conferences are
Yeah.
so important to go to.
Right.
But then the other way of kind of deciphering all through all these categories is understanding the term ablative.
Okay.
Ablative removes the epidermis and then basically causes your skin to regenerate and resurface. Ablative lasers are the best for wrinkles, scarring, real textural issues, laxity. And then there's this category of non-ablative devices, which leaves the skin intact. It leaves the epidermis alone and sends heat into the deeper layers to stimulate a collagen response. So, unfortunately, I wish I could say this was different, but non-ablative, there's really no recovery, right? It's kind of like
Yeah.
if there is, it's very light, it's easy to integrate into your life. And however, it does come with a couple cons, and a lot of that is just high variability rates. Microneedling, I've seen it do work wonders on some individuals, and then others may not have a result at all. So
Okay.
it's really important for each one of us to know going in that some of these non-ablative lasers are not always that, powerful in terms of results.
So so you mentioned microneedling. What
Mhm.
are some of the other non-ablative treatments?
Oh, sure. So non-ablative would be like ultrasound. You guys would probably know the brands as Ultherapy or Softwave. That's ultrasound.
Okay.
And then there is radio frequency, like Thermage. There's
Yes.
microneedling with radio frequency in them. There's also, cool sculpting is freezing fat cells. And then there's red light therapy, which is also non-ablative, and IPL, BBLs. Those
Yeah.
are all devices that are considered non-ablative. But yeah, they're all a little different. I would say the highest variable devices, I would say in my experience, because I've used alt therapy, I've used Thermage, I've used microneedling, all brands, they are just very variable. Somebody in their 30s could do really great, but then a woman in her 60s might not see that same response. So it's just going in, knowing it's going to be a bit of a gamble, but is it worth it for you? It might be worth it for some of your listeners to say, hey, look, there's no downtime. I'll try that.
Right. Right. And I mean, a lot of these treatments aren't inexpensive, right? So
Hmm.
it's really, again, it's something very personal. You have to decide, is it worth it? Is it worth the money? Do I risk seeing it? And I know like things like with microneedling, a lot of times it's not just like one session, right? Like, is it something where they say, oh, get it, and I'm just making this up so you can, but like get it once a month for 3 months in a row and then you'll see a result. So it's not like you go one time and all of a sudden you're seeing a result, right?
Exactly. Yeah. A lot of these non-ablative devices, they require a series or a package. It could be anywhere from 3, sometimes 6 sessions, maybe even 10 if you're doing like tattoo removal. But yeah, they definitely take time. And what we used to believe is we would bring people back in a month after their series is finished and we would take their after photos.
Yeah.
And what we were surprised by is that there wasn't really a response that early on. We would bring them in 6 months later. And then that would be kind of like that magic time frame.
Oh,
So it
wow.
definitely takes
It
time.
takes
Yeah.
time. And so, are there certain skin concerns that you think would be better for, or maybe the non-ablative works better on? Like, for instance, I think I've heard that IPL is good for people that have dark spots or sun damage. Again, I could be wrong, so correct me if I'm wrong. But like that sort of things. Like, are there certain treatments that work better for certain things?
Yeah, absolutely. There's definitely certain treatments that work better. Usually, I always kind of say that there's the 5 pillars that everybody comes in and they ask me about. It's
Okay.
rosacea, melasma, sun damage, laxity, wrinkles, and scars.
Yes.
So those are all kind of the main concerns. And just to kind of, I think if you're really looking at it from a perspective of budget, I would always recommend for anyone to go the route of lasers. So you can
Okay.
do a lighter laser, you can do a more aggressive laser, but those have been proven to be reproducible and predictable in their results. And yeah, they're some of my favorite things to perform on skin for those concerns. Skin laxity in wrinkles with the non-ablative is also, it can yield some good results, but again, we're going back to that expectation level. Like, just don't expect a whole lot, and just, hopefully you're surprised at the end of 6 months.
Yeah.
But IPL is wonderful. It's one of my favorites. So that's a light device, but I kind of always categorize that into a laser category as well.
Okay. And so when you say laxity and wrinkles, basically people that are really want to see a change in their skin for that, you're saying it's laser where you're going to see the
Yeah,
most
lasers.
impact.
Exactly. Lasers have been the gold standard for so many years.
Yeah.
And We keep seeing these new different energy-based devices that we try, and some of them have great results, but we find ourselves going back to the route of the lasers again.
Yeah.
So sometimes newer is not always better in this
Right.
field, and it really takes time for people to test these things out and also really perfect the engineering, right? Because engineering is such a big factor for how these devices work.
Yeah. Okay, so then let's get into lasers a little bit because
Okay.
I've heard of the CO2 lasers. I know that there's something
Yes.
called Halo. But I don't really know much beyond that. But I would love to know what the different lasers are. Tell us a little bit about that.
Oh, sure. Yeah. So if we go back to that word ablative,
Yes.
that's going to really kind of help us decipher between the two. But in terms of lasers, there is ablative, there's also non-ablative. So the lasers like erbium and CO2, those are the most common ablative lasers. And really what that kind of means is we're doing a whole lot of resurfacing. Those
Okay.
wrinkles are virtually gone in 1 or 2 sessions. However, the downtime can be sometimes substantial, like a halo, you said. That's a hybrid laser that has both a non-ablative wavelength and an ablative wavelength. So there is about a week downtime of social downtime.
Yeah.
And how I kind of like to break it down is just for halo or Fraxel. 3 days you don't want to leave the house. You are puffy, you're swollen. People are going to be asking you about, what did you do? But, on days 4 through 7, it's manageable. You can cover that with makeup and you
Okay.
can show up on a Zoom and people really wouldn't think anything of it. Now, when you get to the more ablative lasers, I always tell people it's like 2 weeks before you feel comfortable going to your favorite restaurant, for instance.
Wow.
So it can take a while, but the trade-off with the ablative lasers is you do those recoveries because you know that you're not having to come back for anything for quite a while in terms of wrinkle reduction and sun damage. So the results really are pretty phenomenal.
So what is an ablative laser? Is it CO2?
Yeah, CO2, erbium, let me think here, the fractionated versions like the Fraxel Repair is ablative, the Halo is ablative, the Pro Fractional is ablative. There's a lot of brands, the Ultra Pulse. I can actually, if you ever want, I can list a bunch of just all ablative lasers, but there's like 20.
Yeah. Okay.
There's a
Oh, okay.
lot.
So there's that many.
Hmm.
But like I guess the common ones that we hear as consumers is CO2,
Yes. Yeah.
Halo, that
Yeah.
those are the kind of things.
Yeah.
But so I guess there's really different downtimes for each laser. And the bottom line is the more downtime there is, the more result you're going to have.
Yes. Yeah. A lot of people don't like to hear that answer, but the degree of your result is directly correlated to the degree of your recovery.
Yeah.
And it's just the way it is. And, like I said, I've tried so many other of these non ablative devices, and they just don't get you there as much as some of these other devices that are more recovery do. So it's definitely a trade off. It's hard to manage, like, okay, when am I going to do this? When can I not be in front of people for 2 weeks?
Right.
But that kind of leads me into the next discussion about how we expedite recovery nowadays. We're
Okay.
kind of in this really exciting time, right, with regenerative medicine.
Yeah.
And we have exosomes, we have all these peptides now that are really kind of healing the epithelial layer a lot quicker than without it. So, with my protocol, I'm always using cooling masks, ice. Hypochlorous acid is like a spray that's antimicrobial and helps you heal as well. And then we have copper peptide creams that are also accelerating healing. Exosomes are also a really big topic right now. Everybody's talking about them. Some are a little bit better than others. I would say that the blood platelet exosomes are a little bit better in my mind or in my opinion from what I've used. But yeah, there's a lot of things. Even red light therapy is so common right now. Everybody wants to know, what should I buy? What should I buy? And I
Right.
always tell people, try to get one that has two wavelengths, the 600 nanometer wavelength and the 800 nanometer wavelength. If you get something like that, you're going to have a better outcome. But this is something that you have to do consistently, right? You can't just
Yes.
do it one
Yes.
time and expect to see a result. So those all are really going to help you heal. But what I'd like to do is set people's expectations for 2 week recovery. And if you look better sooner, fantastic.
Yeah. Okay. So wait, go back to what was I can't even remember the word that you said, but exosomes or something like that?
Oh, yeah. Yeah.
What is that?
Exosomes. So basically, what exosomes are is let's just take like a stem cell, for instance.
Okay.
Inside the stem cell, there are these tiny little molecules that signal to other molecules either to regenerate or to degrade. So they have found, I believe this was from the Mayo Clinic, their product called Plated. It's basically they've had a way to somehow, let me think here. What did they do? So they found a way to select the regenerative exosomes and bottle them. So you can put them on
Wow.
topically and they signal to your skin to, okay, we need to regenerate and not degrade. So it's
Very
something very
cool.
interesting, still very preliminary, like data that I've seen in the clinic, but it's very exciting. So
Yeah,
we're kind of in the beginning stages.
I love that. So, okay, so we talked about downtime. I'm curious though, within that downtime, whether it's a week downtime or 2 weeks of downtime, because you see some stuff on social media where I think you look pretty scary,
Oh, yeah.
right? I mean, I think but is it painful?
That's a great question. Yeah, because pain is a number one deterrent, right?
Right.
So,
I think it's a
yes,
little
the short
scary.
answer is yeah, it can be painful, but I think just as much as we're trying to mitigate the recovery, we're also doing a great job nowadays at mitigating the pain.
Okay.
So typically what you'll see is you walk into an office or a surgeon's office and they'll put a topical numbing cream on you. You're going to sit with that for like 20, 30, sometimes 40 minutes. And then you're either given a dental block on top of that, which is an injection into the gum line that will help numb your nerve endings there. Or what I do is just numbing cream and laughing gas.
Okay.
And that is a wonderful combination. You can drive home, you feel just like yourself. You can go out to dinner right after, I mean, if you wanted to. And there really is not a whole lot of pain. I would say that most of my clients tell me like it's a 2 out of 10, 3 out of 10, something like that, but it's definitely manageable. It's
Okay.
when you leave, I think you start to feel like you've had a sunburn almost, like a
Right.
sunburn sensation.
Yeah.
But for everybody across the board, that sunburn only lasts for an hour and then it's
Oh.
gone. So
Yeah, that's
there's,
what I was so you're not like in pain like at home.
oh no,
It just
definitely not.
feels like sunburn and maybe a little tight because you swell.
Absolutely. Yeah. The swelling and the tightness can be just uncomfortable, but
Yes.
there's no physical pain, if that
Okay.
makes sense.
Yeah, totally makes sense. So, for people that have never had a laser before and are just cautious because they haven't ever experienced it before, but maybe they've had microneedling, they might have done some, RF treatments, maybe they have a red light mask at home, who knows? But they want to dabble in laser, but they also want to see an impact. What would be your recommendation for them? Like where do they start? Because sometimes it's hard to jump into a laser that's like a 2 week recovery time.
Oh, absolutely. Yeah, absolutely. I would always say start with a fractional laser.
Okay.
Things like halo, Fraxel repair, the CO2 fractionated, anything fractionated, if you think about whether you're mowing the lawn or irrigating the lawn, right? If you're doing a fractional treatment, that's kind of like poking holes in the skin. So the
Okay.
recovery is a lot shorter. And then it's a lot more digestible your first time around. The mowing the lawn is something that's more advanced, and you should probably wait until you've kind of dipped your toe in the water a little bit.
I see. Okay. So something like a halo, that's only a few days recovery?
So it's 3 days of what I would say you don't want to leave the house
I
because
see.
you're swollen, you're unrecognizable to your family members.
Yeah.
And then on day 4 through 7, all that swelling is gone. And then
Okay.
you're just dealing with redness and a
Okay.
little bit of like sandpaper texture. But
Yeah.
again, so easy to cover with like a really good foundation.
Okay. So unrecognizable to family members. What is that? Because of the swelling?
Yeah, the malar edema. So
Because
for
I'm trying
some,
to imagine what this looks like. And I'm like, wait, what?
oh, I wish I could show you some pictures here of myself because my husband doesn't even care. He'll walk by me in the kitchen and just be like, "Oh, you did the halo again."
Oh my God, that's so great.
But it's just like my eyes get so swollen, and it depends on your anatomy too. If you have high cheekbones, expect slits almost for eyes. But again,
Oh,
icing can help. All that can help bring it down. But yeah, the malar pads, which are located right around here,
yeah.
anytime there's any degree of inflammation, they just really want to swell.
Okay.
So again, it's really only for 2 to 3 days, but expect it.
Okay. Are there any type of like serious side effects that people can experience that they should be aware of prior to going into a laser?
Absolutely. Everybody needs to be aware of side effects. There's different skin types out there. Historically, lasers were really effective, but we had to be very careful about treating skin of color.
Okay.
And the reason for that is they have a propensity in their melanocytes to hyperpigment or hypopigment, which is either darken their skin tone or lighten their skin tone. So now that we have fractionated lasers and we have better technology, we can treat every skin tone. It's just we would probably want to be aware if somebody's Mediterranean or olivey, they're either going to pre-treat with some tyrosinase inhibitor, and your provider will tell you all of this in advance. But there's ways around this now where we can treat everybody safely. The other major risk is infection
Okay.
because we are opening up that stratum corneum. It's susceptible to bacteria and fungal infections. So the hypochlorous acid that I mentioned is a great way. It's a spray essentially to protect yourself. You don't want to sleep with your pets. You don't want to have your toddlers, come from daycare touching your face right after a procedure like that. You
Okay.
just really have to be aware of that first 48 hours because those holes are open.
Okay.
And then the
Interesting.
third risk is really, I'm trying to think here. The third risk, hyperpigmentation, is really, cold sores. So if you are prone to cold sores, sun and stress, and
Yeah.
especially lasers will bring those out. So we kind of treat prophylactically ahead of time. We'll give you an antiviral and oral medication that you can take, and
Okay.
that'll just ensure that, you don't have a problem with it.
Yeah. That makes sense because, like you said, cold sores are brought on by stress. And if you're stressing your face and area out, they're like, boop, I'm coming out.
Oh, that's the last thing you need, like
Yeah.
slits for eyes and a cold sore.
I mean, then you're really not leaving the house. Not like you are anyway. Oh my gosh. Okay. So I have a question because I have heard, like, like with the CO2 laser, that you can do like a lighter, I'm using air quotes, like a lighter CO2 laser where you only have a recovery time of like 2 days, and then you can do heavier where I guess you have a longer recovery time. Is that true? Is that the
Oh, it's
case?
yeah, absolutely true. You can do a lighter CO2. I think the reason why a lot of practitioners and providers kind of steer away from that when they're recommending is the downtime, even though you're going lighter, can sometimes still elicit a lot of redness. So it's kind of like if you're gonna do this, do you want to correct some of the fine lines and wrinkles and sun damage, or do
Yeah.
you just want to go light and have to do this numerous times?
Yes, yes. So that's why you recommend doing a halo at first
Yeah.
as opposed to a light CO2 laser.
Yeah, absolutely.
Okay.
Yeah.
That's great to know. And so if you were to do a halo and you have a couple days of downtime to a week, whatever it may be, like how often do you think people should be getting that?
That's a great question too, because we're triggering a wound response, and we
Right.
don't really want to over treat. There's kind of this fine line with energy-based devices of over treating and under treating, and we're
Yeah.
constantly walking this tightrope. With ablative lasers, I would do no more than 3 per year.
Okay.
And with non-ablatives, like we talked about earlier, that's usually a package and you're coming once a month, and those could be 6 to 9 a year. So with the ablative ones, sometimes I'll have a patient that has a big wedding coming up or a special event, and she really now wants to kind of focus on her skin. So in that case, we would do a halo and then maybe a CO2 in a few months, and then maybe something like a contour TRL in 3 additional months after that.
Okay. Wow. What's a contour TRL?
Oh, that is my favorite. If you've ever seen, we all get them, I think, at one stage in our lives or another, but it's basically those little lip lines. You've seen that women get these barcode lines, smokers lines, whatever
Oh
you want to
yeah.
call them.
Yeah.
They're usually just in dynamic areas from smiling, from laughing, from
Totally.
talking. And the
That's why we're
contour.
not allowed to use straws anymore.
Oh, I know. Well, I guess we're back to the plastic.
Yeah, exactly. But I know
Yeah.
exactly the lines you're talking about.
Oh, yeah, yeah. So a lot of us get those, and there really hasn't been anything in my world of energy-based device that treat them effectively outside of the erbium for me.
Okay.
So the erbium is the energy. The brand name is Contour TRL,
Oh,
and
okay.
it literally will erase those lines, and it's just one of my favorite things to do. It's immediate gratification, so you can't get much
Wow.
better than that.
Yeah, that's amazing.
Yeah.
That's that, and that's what's going to be my next question about the immediate gratification. So once you heal from the laser, whatever laser you got and you decided what downtime works for you and all that kind of stuff, do you see an immediate difference in your skin? Because like, I mean, you're glowing. Like you know, your skin is glowing. It doesn't look like you have any fine lines and wrinkles.
Oh my gosh.
I mean, your skin looks amazing. I'm like sitting here looking at my skin like, oh God, I need to pull this and tug this and whatever. So I'm curious, like how quickly do you see the results from the laser? Because to your point about microneedling, you might get the treatments and then you might not see a difference. And thermage and that kind of stuff too. I think there's like a longer, you know, you're like waiting for the collagen to build up and, you know, it could be months before you see any result.
Yeah.
What can be expected from the laser?
So from lasers, it's more immediate gratification because after you've healed, you see improvement immediately.
Okay.
So you kind of go through, there's 3 phases of wound healing with lasers. First is the inflammatory stage, which is usually days 1 through 3, where you're the most red, your skin looks the most angry. And then you're going through the proliferative stage, which is kind of where your skin is starting to build new collagen. You've got new blood vessels forming. And then up to, I believe, about 6 months, you go through this remodeling phase, which is really where collagen type 1 and 3 are now regenerating in the skin. So it is immediate in terms of color. You're going to see brighter effects from the laser right after you've healed. And with the Contour TRL for those lip lines, that's also right after you heal, you're going to see the results from that. The problem is you're still going to be red. So your eyes are going to go towards the redness and you're kind of going to be like, okay, well, how long is this going to last? So to answer your question, it is immediate with that after you heal. But, you know, there's just other, you know, healing mechanisms that have to take place before you really reach that endpoint.
Yeah. Okay. And then since you're doing all of these lasers, I'm just curious to get your opinion on collagen, because obviously in the science, you're really learning about collagen and building up collagen facially and all that stuff. How do you feel about collagen supplements?
Oh my gosh, Chrissy, I'm so glad you asked me this question. I get it every single day.
I'm sure you do. I'm sure you do.
I had it years ago. I was like, is this really a thing? Should I be drinking bone broth every day? And no, but I did a lot of digging because I wanted to give people the correct answer. And the issue with collagen supplements, they're amino acids, right? Yes. So that's great for your gut health. That's great for your microbiome. But when it comes to getting past the stomach acids and into your bloodstreams and actually impacting your elastin.
And being injected into your cheeks.
Yeah, like I wish that was the case. I really do. Yeah. But you're better off. You know, humans are one of the only species that can't produce our own vitamin C. Yeah. So vitamin C is a huge antioxidant that we all should have. Most of us get it from our diet. Yep. However, nowadays it's hard to come by. So if you're better off getting a liposomal vitamin C, because that is going to help you produce more elasticity in the skin.
Oh,
so not a water soluble vitamin C, but a liposomal fat absorbed vitamin C.
Interesting. So in your experience and from the science and research that you know, it's more efficient for us to be taking a liposomal vitamin C than all of these like major crazy collagen supplements, which again are, you know, it can be good for your gut, to your point, and your gut health. But if you're taking them because you think they're anti-aging or helping you look younger, not happening.
Yeah, it's very, very unlikely. Maybe we'll get some new science and data that suggests otherwise, but the general consensus among a lot of physicians out there that I follow Dr. Stephen Gundry, say what you will about his marketing, but I love his science, and his Plant Paradox book literally changed my life. Like it was really impactful for me. So that's my humble opinion, but he always says, you know, your skin is your gut turned inside out.
Yeah.
So if you see a lot of things happening, you kind of have to really understand that the whole body is systemic, everything's connected. And, you know, so I just don't see how that's really getting into your skin and increasing elasticity. So who knows? Maybe that'll change.
Yeah. No, I think that's a very fair and valid point of view. I also like Stephen Gundry. He's the one who talks about the lectins, right?
Yes.
Yeah. Oh, yeah. I find it fascinating.
Oh, me too.
So I'm right there with you on that one. Okay, so I wanted to ask you something else about some of the other treatments. We talked a little bit about IPL. You said you love IPL. Do you love IPL certainly for like sun damage?
Oh, yeah. Yeah, for sun damage. Well, I guess if we go back to, because I think you had asked me, there's different skin types out there.
Yeah.
So, darker skin types, are they going to want a laser for wrinkles? Probably not, because they have more sun protection in their skin. They're not aging the same way somebody like me is, or fair. So really what they're looking for is pigment lasers to help with scars that are pigmented, or sometimes, acne or more sebaceous skin. So for those reasons, I would always recommend like the AeroLase is a great ND YAG laser that's safe for all skin tones. And then, of course, Moxie is another laser that's wonderful for darker skin.
Okay.
And then, microneedling with RF is great too, because I do think it does help reduce the sebaceous activity if somebody is acneic. So those three are great for skin of color. If we move into the fairer skin types that typically have a lot of rosacea issues or sometimes melasma, wrinkles, you really want to go towards the ablative lasers, like the CO2s, the erbiums, the halos, the fraxels, the IPLs. So that's kind of how I break it down, if that helps.
Yeah, no, that does help a lot. Another question I have about the lasers is I was always told, like, if you're going to get a laser, you have to get it in the winter because you really can't be out in the sun. But let's be honest. I mean, we're talking about you can't leave your house for 3 days or 2 weeks, whatever it is. But when you leave your house, you're in the sun. Whether you're laying out on an island or you're just driving in your car, the sun's coming through. So what is your take on the time of year to get a laser?
Yeah, that's a great question. And there's a lot of different schools of thoughts on this subject, especially in the derm community. I kind of use myself as an experiment.
Yeah.
And I look at a lot of my patients. Quite frankly, there's a lot of us now that are wearing sunscreen, zinc oxide sunscreen throughout the year.
I do.
Every
day. Oh,
yes.
I don't leave the house without a
Yeah. And then
a
lot of people are
physical
wearing that.
barrier on my face.
Yeah. And a lot of people are wearing this like clothing now that has sunscreen in it. So I just don't think we're getting the sun exposure that maybe we used to. And it had to be a seasonal business and you had to wait till the winter. But I myself, a lot of my really well-known patients are treating all year round, dependent on their schedule.
Right.
So we just have to know to be more aware of, like, you're not going to go out golfing all day and you're not going to, you're not going to be at a party all day outside. So just little things like that. But I think you can treat all year round. You just have to be very diligent about sunscreen and heat and staying out of it.
Okay. Yeah. And the most important thing is really being able to find that block of time when you can have some downtime.
Oh yeah, definitely.
Yeah. Okay. And you mentioned ultrasound. I just wanted to touch on that too, because is there a certain time or a certain type of, or a reason why you would use the ultrasound therapy over like RF or microneedling or something like that?
Oh yeah, that's a really great question. I would say that the answer is not necessarily. You wouldn't choose one over the other. I think a lot of these devices are so expensive. They're like hundreds of thousands of dollars sometimes. And a lot of these practices are only going to buy one of something. Yeah. So you might go into one place, they might have the microneedling. You go into another place, they have soft wave or ultrasound or something like that. So the answer is really no. One is not going to be better than the other necessarily. I have full disclosure, I have not used SoftWave. I'm actually interested in the technology right now, so I'm trying to kind of research a little bit more.
Yeah.
But I think they all kind of play the same role. They're all trying to stimulate collagen. They're all non-ablative. They leave the epidermis alone and they're trying to stimulate collagen. So I just have not found like one that's better than the other. I will say this, the microneedling RF for surgical scars, or any scar for that matter, is the best treatment that I have ever used for scarring. Okay. So whether that be like the ropey scars that you might get from a breast surgery or a tummy tuck surgery and you want to flatten it out, the microneedling, has been really wonderful for that.
Okay. Wow. Interesting. And so I know you have your own practice. What are the lasers that you have? Because to your point, not every office can offer every single laser because these machines are highly technical, very expensive machines. And I also think if practitioners want to really be specific in what they're offering, because to your point, you have to really go through the science. You have to understand the technology. So there's a lot of learning behind all of these procedures. So what are the lasers that you specifically offer?
Oh yeah. So, I mean, really what I look at is the science behind it, but also what I've been lucky enough to really learn is just by hands-on experience.
Yeah.
And for me, the hands-on experience has always led to Cyton being one of I consider it to be the Rolls Royce of the lasers out there right now.
Okay.
That could change in the future, but right now that's what I purchased. I got the ProFractional, the Contour TRL. I got the Halo and the BBL, which is kind of like the IPL. And they also have the Moxie is great, but for me starting out, I really wanted to get more of the corrective devices because I know how to use them and I know how to use them well. But yeah, that's one of the industry best lasers out there. And it's just very predictable. The outcomes are great. They're safe. But that kind of leads me into the other point. My industry is very technique driven. So just like injectables, right? Just like surgeries, you really, I can't stress this enough because scarring can happen.
Yeah.
You can scar people and that can be permanent. So I think the best thing, one of my tips actually 3 tips for people is when you go in for a procedure, just ask the provider, whatever they're recommending, say, how deep does this go in my skin?
Yeah.
If you get an answer like, oh, it's pretty superficial, or, oh, it's not that deep. You want specifics. You want to know microns. You want to know millimeters. You want to know that they know what they're talking about.
Okay.
And then the second tip is just asking, what does this target? Does this target my sun damage, my pigment? Does it target blood or blood vessels, or does it target water? If they don't know those basic, questions, I might rethink, getting a treatment done by them. And then also ask about the side effects. Like, what are the common side effects with this device? So, it's really about finding somebody that has done this before, they know what they're treating, and they know the side effects.
Yeah. I mean, I think that is amazing, fabulous advice because...
Oh, great.
Because, having those questions to arm yourself with, to be able to walk in, especially if it's the first time, to be able to be your own advocate, understand, because you really want to feel comfortable. This is, a procedure that, while it's invasive. There is healing that comes along with it. And to your point, there can be scarring and you are creating a wound and it's something to take seriously. It's your face. You want to make sure that it is being done by someone who is a professional, knows exactly what they're doing, and that you walk out getting absolutely the results that you are hoping to get.
Yep.
Yeah, that's awesome.
Precisely, yeah.
Tara, thank you so much for joining me on the podcast today. I know I have learned so much from it. I mean, just in general, knowing about ablative and non-ablative is huge. And I think you've really given us some great information for us to think about because while I have never had a laser and I'm one of those people that I'm interested. I'm just a little scared.
Oh, absolutely. Yeah. We all are scared about it because you see these pictures on TikTok and you're like, oh my gosh, is that normal?
horror stories. You're like, oh my God, what do they look like? But then honestly, like anything else, I was an OR nurse. So I was in many surgeries where I know what the post-surgical looks like, but then you see the healing and you see the outcome and you're like, oh my God, it's amazing. The human body has such an amazing capability to heal. And so the fact that we're really creating a wound and creating damage, but then the outcome is so beautiful and can make such a great impact, it's one of those things. It's like, why not try it?
Oh, yeah, absolutely. And I think a lot of times people are a little fearful of jumping right into surgery, so It's a nice adjunct. It's nice to kind of set the expectations. We're not defying gravity with lasers, but we are really smoothing out your skin. And I think sometimes the two combined, especially working in plastic surgery for 11 years, the two combined is wonderful if you're, a candidate. But I also think that imaging is really important. You always want to make sure you have a great before picture so you can see your transformation. I use Visia imaging, and it's like, it gets very, very close up to your skin and it's really fun. It's fun to see people's reactions after they've had a series and they're like, oh my God, did I look that bad?
They're like, wait a second.
Yeah, exactly. That's not me. You doctored that up.
Yeah, exactly. Well, thank you so much. You've shared so much amazing information with us today. Tell my listeners where they can find you.
Oh, sure. Yeah. Thank you so much, Chrissy. This has been so fun. You can find me in Malvern. I'm at the Skin Science Collective, and I've been there for a couple months now. But yeah, that's where you can find me. It's pretty easy to get to.
Do you have an Instagram or social accounts?
Oh, yeah, I do. So I am Skin Science. So Instagram is the Skin Science Collective. And then I'm also on YouTube under Tara Avidar LE and Pinterest as well.
Awesome. Okay, great. Well, guys, be sure to check out Tara on her socials. You can find me at Suburban Warrior on Instagram, TikTok, and YouTube, where you can also listen to the podcast. And be sure to let us know what you think of this episode. Follow, rate, and review Suburban Warrior, and drop some comments below. We'd love to hear what you think, what your experience has been with lasers, and have you had one? Have you not? Are you thinking about it now? Let us know, because let's get the conversation started. Thanks so much for joining us on the podcast. I'll be back next week with another amazing Suburban Warrior here to share her story with you. Till next time.